Hi everyone, my name is Cheyenne, and this is just a short presentation about my course project that I completed for my senior practicum class for my BSN. In the United States, 50% of CHF patients will be readmitted to the hospital within 6 months of discharge. This inspired my goal for my project, which was to implement an educational sheet for home health nurses to use when providing education to patients about congestive heart failure. During patient visits, we focus a lot on medication education, symptom management, and lifestyle changes. And my goal was to ensure that all the nurses had the materials necessary to provide accurate evidence-based information to their patients. Ultimately, the educational sheets that I was implement throughout my project should decrease the chances of patients being readmitted to the hospital. Achievement of the project goal and objectives. Over the last 4 weeks, I was able to implement the educational sheet among the home health nurses, although I did meet a few limitations when meeting this goal. One limitation was the time constraint and also a small sample size because due to the unpredictable nature of our daily patient population, it's very hard to tell exactly how many patients benefited from the sheet. So because of this, we have to recognize that implementing a sustainable change among nurses may require more than a 2-week period. Additionally, the limited number of nurses that showed up to the in-service that I hosted also could have negatively impacted the effectiveness of the sheet. These nurses didn't get the face-to-face lecture style education that was required to kind of reinforce what was on the sheet. They also didn't get to ask any questions or review the sheet before implementing it. So I was able to meet all 3 learning objectives for this project. The first learning objective, I researched 10 peer-reviewed articles on nursing management of congestive heart failure, as well as the effect that discharge education has on patient self-management and hospital readmissions. After completing the research portion of the project, I was prepared to implement the educational material to the nurses within the facility. So as nurses working in the community, it's very rare to actually see anybody within the facility. However, I was able to provide the nurses who attended the in-service with a paper version of the materials, and the other nurses who did not attend received an electronic copy. So after the 2-week implementation period, I evaluated the educational sheet's effectiveness through surveys and also through analyzing the results that I collected from the previous 2 objectives. The first learning objective, I completed 5 learning strategies, 1.1 through 1.5, which were all set in place to prepare me for the implementation stage. The first 5 learning strategies included reviewing the facility's policies on patient education and also asking my manager what expectations she had of us while we were out in the field and educating these patients. Also, I had to assess the nurses' baseline knowledge of CHF by asking them what they already knew, what they were currently teaching their patients, what popular questions they were getting from their patients, as well as any questions that they had or were curious about regarding CHF. I also had to prepare a lesson plan for the in-service and then create a post-quiz for the nurses to take once the in-service was completed. I also had to make the sheet that would be used out into the field and later set the implementation date. The second set of learning strategies involved me delivering the in-service as well as the post-quiz and actually implementing the educational sheet. And those strategies were all met as evidenced by the sign-in sheet, the quiz, and the survey, which was implemented after the 2-week period. The third learning objective included 3 learning strategies, 3.1 through 3.3, which were all aimed at analyzing the results that I gathered through the in-service by using the post-quiz, as well as the results from the surveys from the educational sheets, and then analyzing the overall project. All of these evidence documents were submitted in a written summary format. The outcomes achieved from this project benefited the facility by setting a standard for patient education. The sheet that was created during the project provided the nurses in the field with a reference sheet that will assist with answering patient questions about CHF as well as any self-management strategies. And most importantly, the knowledge deficits among the nurses were all addressed with either the sheet or the in-service. And now moving forward, the nursing staff have the knowledge that is required to better educate their patients. This educational sheet can be utilized in everyday nursing practice. It can be utilized, one, as a reference sheet for nurses to provide education to patients, or it can be edited in a way that it can be used as educational material for patients, and it is more patient-friendly once it would be edited. Also, the project outline itself can be used to create additional educational sheets for self-management of other diseases such as diabetes. In home health, we're consistently teaching and providing education to patients, and just having a reference sheet about the diseases that are prevalent within the community will be extremely helpful. Completing this project has contributed to the value of my lifelong learning. And once I'm no longer a student, I still am going to continue to learn and improve myself. And this project has showed me that by speaking with people and utilizing the feedback that I get from my peers and my mentors, I will be able to track and see where those areas of improvement are. And lastly, this project has forced me to utilize my communication and interpersonal skills by speaking to my mentor, by speaking to patients, by speaking to other nurses, and this will all benefit me in the future. Here's a short list of some references that I used throughout this presentation, and I thank you all for listening, and I appreciate any feedback or comments that you may have.